Welcome back. This is the third segment of this lecture. So, in this segment, we're going to look at the relevance of spatial analysis or GIS techniques, the spatial analysis technique in health and different types of spatial analysis. So, let's get started. The spatial analysis and health is very important. I hope I've been able to make that quite clear to you. However, we know that determining the relationship between health and various risk factors is always difficult because it requires a lot of investigation and data, and at times the data may not be available at the scale that you want to work. So you have to look for potential indicators and factors or surrogates that can help you to get a better understanding. However, with this challenge, there is the possibility, for example, if I want to study uh, risk of malaria in certain place, I could look at the amount of rainfall, the potential habitat for malarial vector, mosquitoes, the environmental condition. So if I understand the environmental condition that is conducive for malaria for mosquito to thrive, certain species of mosquito carrying malaria parasite, then I can use that to create an understanding of where the risk is higher, where the risk is lower. So geospatial techniques becomes very valuable there. So and the other benefit is we can integrate data at different levels, at different uh, spatial over large extents, and we can look at spatial factors, we can look at temporal factors, and combine all of these within the same GIS environment, geographical information system. So GIS lends itself to this kind of integration. Also, since diseases are usually multifactorial in nature, geospatial techniques and tools becomes very, very important in understanding dimensions around the spread and the outcome for different people. So this is where collaboration comes into place, whereby people with specific technique understanding of the techniques in GIS, remote sensing, comes in contact with people in public health and in medical geography and other aspects of that to create new understanding and insight that can address health related issues. So when we put all of this in perspective, it becomes very important that when we understand the first order and the second order effect that I explained earlier, receptivity of a location and interdependence of events, it becomes very, very important and relevant that GIS and geospatial technique is deployed when we are studying health geography or when we are trying to understand health outcomes for people. If we now begin to look, what kind of analysis can we carry out? We can look at inductive spatial analysis, whereby we're trying to look at data and understand the patterns, and generate new theories and general principles. So, for example, I may be investigating the pattern of disease spread, and from that, trying to understand and create new understanding about or theories about how this disease is spreading. Or I might be looking at creating a new understanding about where is the source of this disease. Because if I trace the disease over time, the spread over time, it can link me back to where the disease started. So this is an aspect of inductive spatial analysis. We can also have the deductive spatial analysis, whereby we're testing known theories or principles against the data we have. We might want to look at whether the data we have is fitting into the understanding we have about how particular disease spreads, or the theory of existing theories and principle of how disease spreads, or how certain things, maybe behavior of people in terms of how they spread information, how they spread knowledge and things like that. We might want to check whether our own data is fitting into this established body of knowledge. Then the third type of spatial analysis is the normative one, whereby we are trying to develop a prescription, a design, a solution. So a very good example is to design access regions or optimizing location for Southern delivery. So we have, for example, maybe we are trying to optimize the location of primary health care in Oyo State or in Port Harcourt City or Ibadan metropolis. So we are trying to say where are the best locations that will optimize access for people for getting medical care. So we look at where we currently have them and look at where are places that have unequal access. Where should we put those facilities to make sure we improve access for people? So we are designing new solutions and new ideas or prescription for how to do things better. So these are the three types of or categories of spatial analysis: inductive, developing new theories and general principles; deductive, testing our data against known theories and principles; and normative, developing new ways or better ideas or better solution of doing something. So, with these three in mind, let's now look at some examples, general examples about of application of GIS in public health, in health geography, in medical informatics, and so on. So let me just put it as public health. Okay. So need analysis. People are different across the population. Population vary over space. So with this variation, we know with this variation in mind, the healthcare need, ability to access the healthcare, the types of services people will require, their willingness to get that, to go and seek these services, and their ability to even utilize these services will vary. So we need, once we understand that that is the situation, then we need to do a need analysis and make sure we provide what people need in such a way that they can actually access it. So we can be looking at, for example, if we create community health profile, CHP, which describe the demographic, economic, lifestyle characteristics, and exposure to potential hazard, we can use that to now start promoting primary and preventive healthcare. For example, if we know that certain population in certain place they are more they have more incidence of asthma and diabetes, then we can start looking at how do we implement some preventive and primary healthcare services for them so that we can limit hospitalization, because this asthma and diabetes, they are ambulatory care sensitive, because people with asthma and diabetes, they might go into shock or go into an emergency situation often. But if we provide services close to them, primary healthcare services or preventive healthcare services, it can limit the rate of or hospitalization in that area. So this is something that can bring about cost effectiveness, because timely intervention reduce the amount of money you have to spend on providing ambulances and then taking them to the hospital. So if we do preventive, then things get better because now that preventive action is based on understanding the need of the people in that area. Another aspect would be looking at service area identification. So if we look at uh, neighborhoods that have similar characteristics, that can help us know where should we put a particular service delivery center. For example, if we look at cancer treatment, or we look at cancer screening, or we look at maybe dialysis center and things like that, if we know that certain areas or neighborhoods, a lot of people have this kind of ailments, that can help us to optimize where should we put the service delivery center. So, you see, the key word there is location. Where do we put the service delivery centers to optimize service delivery? We can also look at the aspect under need analysis. It can also help us to look at risk factor and health outcome prediction. Because if we understand the association between mobility, mortality, economic, socioeconomic status, services accessibility and utilization, we can use that to start designing how do we provide adequate services to promote health and well-being. So this is these are some examples of how need analysis become useful in providing adequate public health care for the population. Another example is analyzing access. So healthcare access, remember I highlighted that before because there are so many dimensions to access. So, but if we look at access in a broad term, you can say is the ability of the people to use the services when and where they need it. So, time and place. Time and place. So, which means they have the access and they have the ability to use it when they need it and where they need it. Okay, not where it is available, but where they need it and when they need it. So, we know that some population are usually they have barriers in obtaining healthcare. So by doing access analysis, we can be able to start formulating policies and intervention that can impact on the location, the quality, and the quantity of services available, and ultimately improve access. So remember, access is about providing the ability of the people to use the services when they need it and where they need it. Not that where it is available or when it is available, but whenever they need it, it is there, available for them, and where they need it, it's available. So this is what we are trying to do, what we try to do whenever you're doing analysis of access to healthcare. So, but we also know that healthcare decision by people is determined by the types of healthcare services that is available, the quality, distance, the time, and the cost, as well as the ease of travel. So, for example, I was in into the discussion with some of my colleagues, and we're talking about the issue with many of the tertiary healthcare institutions. They are supposed to be tertiary. However, they have started providing the services of primary healthcare, secondary healthcare, and now tertiary healthcare. And this is putting excessive burden on those tertiary healthcare service provider in providing the tertiary healthcare services. So the decision for people to go to those tertiary healthcare service delivery points is affected by the type of what is available in their area, the quality of what is available, the distance, the time, the cost, and the ease of travel. However, different kind of ailment can make people even forego the issue of ease of travel or the distance and just go the extra mile to try and get the services. So This brings about the issue of inequality of access. So, if we understand access, we can address this issue of inequality of access and thereby implement new plans that are better than the current plan. Our work on geographical accessibility to primary healthcare is an important one because we looked at where are people likely to go and seek access to primary healthcare and how far they have to travel, and we use the WHO standard to see how far they have to travel and use this to understand the limit of their access. So we have special decision support system whereby we combine all the different aspects that I've been talking about earlier, all the different applications. We put it together in a decision support system whereby uh, the decision makers can look at a database and pose different questions and get answers, run different scenarios and get answers so that they can know which way to go and which strategies to follow. So this is a new area that is evolving and is getting traction in time. And I want to point your attention to a very interesting work by Lee et al. In 2017, whereby they look at they designed a floating catchment area decision support system so as to help understand accessibility and improve on accessibility. So they worked at a regional scale so that healthcare providers and actors can look at this and use it to plan for healthcare access. This segment is getting too long. I don't want it to get too long so that you'll be able to watch the video easily. So I will split things a little bit up. I've provided some other examples like Dueling et al. 2010, looking at access as well. Van All 2014, looking at walkability and how to use it to encourage physical activity. Angel et al. In 2014 looked at extending uh, health insurance coverage across some areas in the United States, and Actuary 2005 looked at the importance of geographic and spatial behavioral factors in understanding what makes people use particular healthcare services in the rural community. So this is just, I know it's very quick, but the idea is to provide you with some examples, and this can help or stimulate your exploration of different aspects of LGIS applications. So I'll see you in the next presentation.